Radio अपना फ्रैंकफर्ट दिल से कहता है. Hello everyone, I'm Raman from Apna Frankfurt, and in the series of interviews and discussions that we are having today, we have a very special interview. Well, we know superheroes are the ones who save our lives, and in the era of coronavirus, we all have realized that the medical staff, such as doctors, are our real life superheroes. And today, we have such a superhero with us. Her name is Dr. Sindhuja, a practicing doctor at Kreis Krankenhaus in Strobenhausen near Munich. Thank you, Dr. Sindhuja, for taking out the time and joining us.
Thank you, Raman. That was such a great introduction, I must say.
Well, it's our pleasure, Doctor. So, Dr. Sindhuja is one of the doctors of Indian origin. She's leading the fight against coronavirus for all of us while practicing in Germany. And today we have an opportunity to listen to her expert comments and see the situation from her point of view. So, Dr. Sindhuja, before we go into some detailed questions, would you like to tell our viewers and listeners something about yourself?
Yeah, my pleasure. Well, I have finished my MBBS and MS from India, and currently I'm working as a resident doctor in the Department of Surgery. So basically, I'm a surgeon. But this corona epidemic, indeed pandemic, this has been so that all the people from various departments are treating the patients affected by corona.
Yeah.
So all of us have exposure to this.
Right. And I mean, thank you very much for stepping into this, because we know every doctor, every medical practitioner who is stepping into this is also taking a lot of risk. And thank you for stepping into this and helping all of us. Well, let's jump into some key questions now. Yeah, you work near Munich, and that's the capital of Bayern. And we also know that Bayern is the most impacted state by coronavirus in Germany. So from a medical perspective, why Bayern is so badly hit? I mean, what has the Bayern government not done or done to improve this situation till now? Your opinion on that, please.
Well, as far as my understanding is concerned, the first case that's being detected was in Byun. Maybe that could be the reason that this has been transmitted like so very rapidly in Byun. As we all know, the percentage of older population in Germany is very high. And in Bayern, like few statistics say that old age homes have also been affected.
Yeah.
So there is very high risk of mortality when it comes to older age population. So that could be one of the reasons, but maybe because it has been affected earliest, the cases have been recorded more. That could be one of the reasons.
Yeah. I mean, Bayern was caught up in a case where Germany was not prepared for it, in my point of view, because as early as 27th of January is where the first case in Germany was found in Bayern. So yeah. Yes.
Back then, people weren't prepared. Even the government wasn't prepared. I think nobody had expected that it would go on such a great extent. Exactly. It was only on 21st of March, the lockdown is being imposed. But I think the Bayern government has been taking very good measures. Like from the very beginning, as soon as they figured it out that it would cause a catastrophe, they immediately imposed, in fact, they enforced all the measures of public distancing. They have been educating people regarding all the measures that have to be taken. And the lockdown is being strictly followed. I must appreciate people for following them. Majority of them did follow, and I think the statistics show that the plateau has been reached, the cases have come down, the mortality rate in Bayern has come down. I think all of these really helped out.
Yes, no, I completely agree with you. And I think it's from, as they say, from the top level to the shop level, from administrative level to the people who are on the ground. Everybody has worked as a team to really support the fight against coronavirus. And I think that it is showing results now. Yeah. So thank you for your opinion on that. Let's move to the next question now. Well, coronavirus pandemic, it's a challenge for all of us, and especially for the medical staff worldwide. So as a doctor, has this pandemic led to some kind of a new experience or learning for you that you had never expected before? Your opinion on that?
Yeah. Infections are not uncommon in hospitals. Of course, we expose ourselves to many infections, but this has been something very new. Like we always get in touch with the patients who have got infections and all, but with precautions. But since this is something new, and there's every chance that people are being infected and we do not know because they're not diagnosed. So the risk of transmission was very, very high in this case. So we were also scared. And the measures that were being provided in the hospitals in the early stages, like we were not asked to use masks unless we are sure that the patient has, or we could suspect that the patient has corona. So it was like very unsure in the beginning stages. We were also like little scared, but we had to perform our duties.
Agreed.
So we were exposing ourselves to the risk, but at the same time, I think the younger population, they did apparently very well. They didn't contract the disease so early. I myself have gone to patients who were like tested positive after I getting into contact with them. But I got myself tested and I was negative. So I think the risk of transmission indeed is high, but as long as we consider younger population, yeah, they're doing it very well as long as the immunity is good. And I think the hospitals have also taken very good measures. Like as soon as they figured it out that the cases have been increasing, there's been increasing trend, they stopped visitors. So all the visitors were prohibited. So the patients were also like treated in individual rooms. Most of the patients were isolated. I find these measures have like really helped in containing the disease. And the number of testing centers, I feel Byun has been doing very good. It's like they have around 3020 ventilators. They're very well prepared with the intensive stations. They test like around 13,000 people per day. I think that's a huge number. The more the people are tested, the chance of earlier detection is high. And since the cases are mild, the treatment success is also like high. And everybody has been doing a great job. Even during Easter holidays, people were being tested. I find it like really great. People are putting themselves at risk to help containing this pandemic.
Yeah. And I mean, I can understand because I've been talking to a lot of medical practitioners in the last days, and the amount of pressure that it has brought on all of you. I mean, the extra working hours that everybody is putting in, own health risk, concerns for own families. I mean, besides that, you guys are standing like a wall in front of all of us and protecting us for that and working on Easter holidays, working on weekends. Thank you very much. Thanks a lot to you. Thanks a lot to all the medical practitioners who are standing like a wall in front of us. Thank you. Yeah, can't thank you enough for that. Well, moving on to the next part here now. Well, and this is the question that I always wanted to ask an Indian doctor here in Germany. Yeah. So it's more like, so when it comes to the medical system here, we all know that the Indian mindset and the German way of medical treatment, there are some differences in there. I mean, I think it's more of also the perspective difference. So any key information from you to Indians in Germany, how can they understand the doctor's perspective here better and how to deal with this current situation in a better way?
Well, as far as my understanding is concerned, the doctors here in Germany are overburdened. People usually feel that they aren't given enough time. They're not heard most of the times. That's the most common complaint I've heard.
Yeah, agree. Yes.
Yeah, to be very frank, all the doctors are here like really overburdened. They do not have enough time. I think as far as the rules are concerned, every doctor is supposed to allocate like 15 minutes of time for each patient. But what most of the doctors do is not every patient requires 15 minutes. There are cases with mild symptoms. There are cases which are like really an emergency. So what they try to do is they cut short the time for these mild symptoms. So maybe they reduce it to 5 minutes and they use those extra minutes for emergencies. So emergencies are something not that you could deal in 5 or 10 minutes. And coming to Indian practice, if I have to compare, we Indians, we really have an access to local pharmacies. Most of the people, instead of making an appointment with the doctor in India, if they have got mild symptoms, they just rush to the local pharmacy and get their medicines. They get access to all the medicines,
Yeah.
which doesn't happen here. I know all the medicines are not being prescribed because the guidelines that are being followed here are different from what are being followed in India. So German doctors follow their own guidelines, and yeah, the cure rate has been good. Germans are doing well. So I think we should have trust in them. Yeah, that's been helping.
Yeah.
If you're not happy with one doctor, you can always take a suggestion from another doctor. It's
Right.
not that doctors are limited.
No, thank you. Thank you for putting a doctor's perspective there, because we know a lot of people who come from India, they are exactly making the complaint that, yeah, we went to the doctor, they didn't look at us properly, they didn't spend time with us, but we never understand the other side of the story. So thank you for bringing out this awareness among us. Thank you. Moving on to the next question now. Well, in this current times, we have many Indian parents who are in medication needs, and their medications are running out because they are now overstaying here, which is unplanned for them. Now, would you like to help all of us by giving us the official way of getting some medication from India to Germany? What is your perspective here?
Well, like all the medicines that are available in India are available in Germany as well, because the composition remains the same. Like, I think this is the easiest way. They just have to visit their house arts and get those medicines prescribed. If the house arts finds that these medicines are maybe do not cater to the needs, then he can always change. That should also be fine. So what one should do is trust the doctor.
Yeah.
And other ways, this AMT responsible for Arzneimittel is this medication. They can reach out to the local numbers, they can call up, they can inform what the problem is. They can usually call on this sole central number as well, so that the medicines that are being shipped are not being held there. And usually when this procedure is being followed, there is high chance that they get their medicines back from India.
And I think it's important also here to mention that without having this approval, we should not try to get the medication by postal way directly, because it gets caught at the soil. Then you might even end up paying a lot of fine for that. So following the official ways is the right way. Yeah.
Exactly. Yeah, shipping of drugs is like prohibited unless and until you have a valid reason, valid permissions. So it's always better to go in an official way.
Yeah. No, thank you. Thank you for clarifying this. I mean, during this coronavirus times, we have gotten this question a lot of times, and thank you for bringing more light into this. Now, so coming towards the end of our interview today, I know you are very busy these days, and thank you for taking out the time for us. Any short message from you, Dr. Sindhuja, for all of our listeners and viewers?
Yeah, to all the listeners and viewers, what I would like to say is Germany has been easing out these all the impositions that are being imposed in the last few days. So it's only for further maybe like 1 or 2 weeks that we have to stick on to these. And I think people have really helped it out in containing this disease. And the health minister Spahn has also announced that this disease is being brought under control here in Germany. So everybody has been doing a great job. So I would request everybody like another 2 weeks to stay home, and all the public health measures should be followed. All the standard recommendations that are being advocated to be followed, not only now, even after the lockdown restrictions are being eased out.
Thank you, doctor. Thanks a lot once again for taking out the time, and thank you for bringing out this support for all of us, for protecting us from this coronavirus and leading the fight against coronavirus for us. Thank you very much for your time, and we'll definitely stay in touch. Yeah, thank you.
Thanks a lot. Yeah.
अपना फ्रेंड फहद